All right. Hi, hello, and welcome. This is an emergency live session because we were initially hosting it on Instagram and now we're moving it to Facebook. All right. So let's just continue with our conversation. Dr. Apurva, you have been incredibly patient with us. Thank you so much for that.
Not an issue.
All right. So let's move on to the next question. Dr. Apurva, does smoking and drinking also affect fertility?
Yes. So smoking, especially cigarettes, would have a lot of toxins in them, which have a direct effect on both the egg quality and even the sperm production. So egg quality is directly affected, and it also basically brings down what we call fertilization rates, that is the egg and the sperm joining and forming an embryo itself, and increases the abortion rates. And similarly with sperm, smoking has a huge effect on the motility and the quality of the sperm. So if motility itself is affected, then the sperm doesn't really reach the egg, pregnancy doesn't happen. And if quality is poor, then again, chances of abortion also keep increasing. So there is a direct link between smoking and infertility, both for men and women. The problem with women is, since eggs are produced at the time of birth and there is no change in the number or the quality that happens, smoking is basically going to affect the quality going forward. So stopping smoking in women is only going to make sure that there's no further deterioration, but the deterioration that's already happened isn't going to change. Whereas in men, because there is a constant production of sperm that does happen, stopping smoking starts showing an improvement in about 3 months or so. And there is a change to non-smoking levels in about 5 to 10 years overall. So stopping smoking is good for anybody who's trying to conceive, but in women, changes are irreversible and men changes are reversible. Alcohol, on the other side, as such, for as long as it's moderate consumption, mild to moderate consumption, doesn't really affect. But alcohol has especially effects on pregnancy directly. It causes problems in the baby. There's something called a fetal alcohol syndrome. So it can cause mental retardation, certain growth developmental defects. So completely avoiding alcohol at the time of conception and pregnancy is the best thing to do.
Yeah, I think that makes a lot of sense. And I have heard a lot about how dangerous smoking and alcohol both are. You had a question related to periods, isn't it? Yes. So she's been dying to ask a question. I can just pass the mic to her. Please go ahead. It's all yours.
This question has been from a long time. I really want to ask it. I don't know why on my period 7 days long. It feels like they never end.
That's a lot of people's complaint. So basically, periods, our normal range is between 2 to 7 days. So you fall right in there. Okay. Less than 2 is a problem. More than 7 is a problem. Now, as long as you're having regular cycles and you're not losing too much blood, in the sense that how we quantify too much blood is when you're menstruating, you pass a lot of clots. Normal menstrual blood just flows, which is a little thick mucoid-ish kind of flow. But when there is thick clots that are being passed, that means you're bleeding heavy. 7 days is something that you can't really control. If your body decides it's 7 days, then it's 7 days. It's really not going to change. But like I said, as long as it's not associated with heavy bleeding, it's all right. But if it crosses 7 days, or for other people, if it is less than 2 days, or if it's associated with heavy bleeding, or you're debilitated during the period, that is, you become incapacitated to actually do any kind of work, then you would do well to meet a gynecologist to just make sure everything's all right. Because there could be issues like fibroids, polyps, hormonal imbalances can be there, thyroid can be abnormal, all of which causes a little bit of a longer flow and a heavy flow. So just making sure everything is fine. If everything is fine, there's no issues, you're bleeding for 7 days and otherwise healthy, there's nothing else that needs to be done. You'll have to live with the 7 days, unfortunately, if everything's fine.
It's your body being its own host.
Basically.
Thank
So
you so much.
everybody has their own normals, basically. Everybody has their own normals. So when it deviates from that, you'll have to kind of get checked out, because you know your own bodies pretty well. And if there is a deviation from what normally happens consistently over 2 or 3 cycles, then getting a check done is always a better idea.
All right. And let's move on to a question from Devasmita over here. She's asking, how long can someone delay their pregnancy? Very pertinent one, Devasmita. Very important question here.
Okay, so that's a very tricky question to answer, because each woman is different and each couple is different. One of the important things to remember is that women basically are born with all the eggs that you have. So you have your entire collection that is formed and released throughout your life, formed by the time you're born. All right. And this keeps constantly decreasing throughout your life. Now, what you're born with determines how many keep reducing, because there's a fixed percentage that comes down every month, and as with every passing year. So what you start with is what is important. So generally, the younger you are, the more time you have to delay pregnancy, and the older you get, the sooner the better, because egg quality and egg numbers both deteriorate with age. So there's no cutoff per se. We generally say about 35 things get more difficult, and what we have seen in the Indian scenarios, about 30 things start getting difficult. But if you're looking at postponing pregnancy, then the best thing to do is to assess your current function, as to ovarian function, as to how things look. How many eggs you have, what is your probable time, because nobody has any symptoms of declining numbers of eggs. It's only when it's done and dusted that you actually start having symptoms. So the best thing to do if you're looking at delaying pregnancy is to make sure your current fertility is good. And it'll also give us an idea of how much time you generally have. And there's another option that you can look into, something called fertility preservation. So if you are looking at delaying pregnancy for any reason, it could be social, it could be career, it could be because you don't have a partner at this point who you want to have children with, you can always freeze your eggs and use them for a pregnancy at a later time. So consider you freeze your eggs at 29 and you choose to have a baby at 39. You have babies with a 29-year-old egg, which gives you a much better outcome. So that's definitely an option, rather than delaying pregnancy without having that backup with you. Because age does make a huge difference.
I think that's a very good answer. So the biological clock is real in some way or the other, because women post 25 keep hearing it, बच्चे कैसे होंगे, कब होंगे,
It's a real thing. I mean, nobody wants to hear it. It's especially in the current era, nobody wants to hear the biological clock is ticking, because a lot of other clocks ticking in terms of career and everything. But it's a very real scenario where the biological clock is literally ticking in terms of the drop of egg numbers, because medically the 20s is the best time to have pregnancies with the least amount of complications. Now, 20s is also the time you're building your career, you're building your life, basically, you're figuring yourself out. And not everybody gets married at an age where they're already ready to have a child by the time they're in their mid to late 20s. So everybody, I think, I hope we eventually move to this, that people start thinking about fertility preservation, so that they don't have to worry about the clock ticking. You can always still try naturally, conceive naturally, and it still might happen. But this will still be there as a backup, just in case things don't work out at a later time.
That's a good plan. We have Angela over here who's asking, what is the permanent solution to get rid of hair with PCOD?
Facial hair with PCOD. Okay, so one of the basic issues with PCOD is something called a testosterone excess. So a lot of patients with PCOD do have what we call hirsutism, that is hair on the upper lip, hair on the face, which is thick and almost masculine-like. So there is no real permanent solution. The best thing would be to actually look at laser hair removal as an option. Again, it's not completely permanent, but it does reduce the thickness of the hair as such. And the more control you are, like I mentioned before, in terms of PCOD, the more control your lifestyle and diet has, the better these hormonal issues get, and the better your symptoms get. So there are two options. One would be to go on what we call oral contraceptive pills, which control the testosterone, which reduce your hair growth. The other would be basically it's a dermatological solution where laser hair removal can be tried. As long as you keep your diet and exercise also under control, that solution would be far more effective. You might require 5 to 6 sessions for you to see a real change, and maybe once a year or once in 2 years, booster kind of sessions just to make sure the hair stays down. I can't hear you, Anjali.
Yeah, this is Anjali.
Yeah.
I have accepted the fact that there is patient here, and I think the best you can do is manage it. I think having an active lifestyle is also very very important. Making sure you're active, not living a sedentary lifestyle. That would be very common, especially during the pandemic. Right? I hope I'm not wrong.
Correct. A lot of people are ending up working from home and not even like getting out of their house to go to the office, which would at least be the bare minimum exercise that used to happen before. But now that hasn't. So a conscious choice has to be made to make exercise an active part of life, basically.
Yeah, definitely. And that's not
correct.
Okay. So, how effective are fertility when it comes to fertility, somebody wanting a pregnant at a later stage in their life? What are the chances of success?
So there are multiple treatments that are available. We have probably 4 levels of treatment. The first being what we call ovulation induction with timed intercourse. This basically means that I'm going to give you a couple of medications to get your egg to grow, and at the time of ovulation, tell you when exactly to time your intercourse so that there is sperm available at the time of ovulation. So this is the basic bare minimum treatment. This works very well in patients with PCOD because their basic issue is ovulation, and as long as the male partner is normal, pregnancy chances are good with this. Then comes the second option, which what we call as ovulation induction with IUI. So this is something that we use for mild male factor infertility. So there is slight motility issues, slight borderline number issues. So in this, what we do is I give a couple of medicines to the female partner to grow the eggs, and at the time of ovulation, we deposit what we call the processed sperm. That is, we separate out the good motile sperm and put it directly inside the uterus, so that the total distance it has to move, the sperm has to move to reach the egg, reduces. So this has a pregnancy rate of around 15 to 20%, and we can try it up to 3 cycles. Then third treatment that would come in is an IVF treatment. So direct IVF is basically reserved for people who have both tubes that are blocked, whose egg numbers are low, who have a condition called endometriosis, where there's severe male factor, where the sperm numbers are very low, the sperm motility is very low, or people who have tried 3 cycles of IUI and not conceived, and then we move to an IVF. So there are multiple reasons where we do an IVF. IVF overall has a pregnancy rate of around 60-65% or so, can go up to 70%, and this is quite dependent on the age of the woman. So the older you get, the harder it gets to get pregnant even with treatment. So that's something that everybody has to remember. IVF is not a magic wand that I can just, you can come in at any age and we'll definitely get you to conceive. So age is definitely a determining factor there. And then these are the treatments that is used for their own eggs and their own sperm. Now, there are certain conditions where there is no eggs at all in the woman, or there's no sperm at all in the man. So then we move on to what we call a donor program. So we get donor eggs or donor sperm, depending on where the problem is, create embryos out of that, and then transfer it back into the female partner. So essentially, she's the one who carries the pregnancy and delivers. So this has a very good success rate of around 70 to 80%, again, in properly selected people. And the last option is what we call surrogacy. So surrogacy is basically using a third person for carrying your pregnancy, and then they hand over the baby to you once the delivery happens. So this has very specific indications, like if there's no uterus. Now there are women who've lost uterus either because of cancer or because of some surgery, and they don't have a uterus to basically carry a pregnancy. Or they have a highly distorted uterus where pregnancy is not possible at all. Or there's a medical condition where they should not be carrying a pregnancy at all in the first place, and surrogacy is used. So surrogacy has a similar pregnancy rate of which is similar to an IVF. So these are all the fertility treatments that are available. The treatment that would be decided for you basically would depend on what the condition is. So we'll have to look at what issues that you're dealing with, how the male how the male and female issues are interacting, and then decide a treatment plan. So fertility there's no cookie cutter approach per se that everybody gets the exact same pathway. We have to personalize treatment basically to maximize the chances of pregnancy in the least amount of time, because with each passing month and each passing treatment cycle, the stress increases, the expectation increases, the burden also increases. So the best thing to do is to get a consult. And I would even suggest this doing even before you try for pregnancy. So this is what we call preconceptional counseling. So where we see what the issues are, if there are any issues that need to be treated and preemptively looked at, and whether you would require treatment sooner rather than later. Because infertility basically is what we define after 1 year of trying, that if you're not pregnant, you need treatment. But I do see people who come in after 10 years, 15 years, 20 years of trying, and they've not really taken any treatment. So don't wait that long. It's not ideal. Within a year or two of trying, if pregnancy hasn't happened, please get to a doctor close to you so that your evaluation at least can be done and decide treatment according to that.
Yeah, and that makes a lot of sense. There's also lots of options out there. But I do have a question. For a legal question, I do think when it comes to ARTs and surrogacy, anybody or is it altruistic now?
You are talking about the surrogacy bill, right?
Yes, the surrogacy bill.
Okay, so at this point, it has not been passed in the parliament yet. So it doesn't have to be necessarily, but once it's passed, then yes, it's altruistic surrogacy. It has to be a close relative of the couple who will agree to carry a pregnancy. At this point, we do commercial surrogacy in the sense that the agents source surrogates, we screen them, and the couple uses them, and there's legal agreements between the two to make sure that both are safeguarded. So at this point, the surrogacy bill is not yet passed, so it's still up in the air. But yes, once that comes in, altruistic surrogacy is the way forward.
Okay, thank you. About her periods.
Sure. Right now, you don't so I would really like if you I'm appreciating first 2 days.
So, is this the first and second day of the cycle? Is this the first and second day of the cycle?
Yes.
Okay. So this pain is very, very common. Most women have it, all right. And mild over-the-counter painkillers will basically suffice for this. Now, if you have pain that starts before your period and sticks around after your bleeding stops, then you need to be evaluated for something we call as endometriosis, which is basically an inflammatory condition that happens and causes problems like this where there's severe pain. So if it's the first 2 days, over-the-counter painkillers usually take care of it. You can try that and see how it is. Anything beyond that, or if it's too heavy, get to a gynecologist. That's what you'll need.
Sure. Thank you.
All right. Now, I will move on to one question, and we've discussed in today's podcast. Dr. Apurva, we also got a lot of questions about reproductive health in general. One of the most common was how frequently should one get a pap smear, and how many checkups are needed, just to make sure that we are up to date with reproductive health.
Okay, especially in India, gynecologist visits are not routine. So that needs to change. Pap smears basically are required to be done every 3 years once you cross the age of 25. Earlier, the cutoff was 21 years of age, but now it's been reduced to 20 from the age of 25. So this is basically to look at whether cervical cancer is starting or happening, because it's one of those cancers which happen even in the young. So we have two incidences that happens in the mid to late 30s, and then once you've crossed 60. So that's why 25 years of age screening is started, so that we can pick it up and treat early. Because usually if there's been no screening done, we pick up cervical cancers in stage 3, which is very difficult to treat, which has a very low survival after even with treatment, and even if survival is there. So if quality of life is affected, then it really doesn't make sense. So the point of pap smear is to detect the cancer at such an early stage that treatment can happen quickly. Now, since we're on the issue of pap smear already, an analog to pap smear is vaccinations for cervical cancer. So this is one of those few cancers which are caused basically by a viral infection that affects both men and women. So there are vaccinations that are available to prevent this infection. Prevent infection basically, and since infection is going to be prevented, even the incidence of cancer reduces. So this can start at the age of 9 years, and it is recommended up to the age of 26. So people who haven't been vaccinated or who are in that age group, please do consider. Women who are older here who have children in that age group, please do consider, talk to the pediatrician to make sure that that vaccine is got, because it's one of the few vaccine preventable cancers that we have, and that would be a great way forward basically for women's health.
Absolutely. I'm just going to get it as soon as possible now. Thank you so much. We have asking, there is a myth that can you please elaborate? So,
not really. See, there's no scientific basis that there should be no painkillers that need to be taken. Yes, there are a lot of myths regarding painkillers, that you take too many of them and you can end up with kidney failure and whatnot. But again, prescribed painkillers in the dose that need to be taken and for the duration that they need to be taken is not an issue that would be a problem. All right. And there's also this thing that period pain, a lot of religious connotations also to this, because period pain is supposed to be good for you in whichever way. And it's apparently punishment for being a woman. That's also there. So, so you don't need to suffer. I just want to put it out there. You don't need to suffer. Please take the painkillers. It's all right. And there's no harm in taking it, as long as it's a medication that's prescribed for you and for the dose that has been prescribed for you based on your weight, basically. That's quite important.
Thank you for saying that. I will say that you have to
yeah.
Take your Okay. All right. Now, moving on to the next part of the question, about vaginal products. There are lots of them out there, right? Some are like PhD. There are a lot promise you beautification. I would love to know your.
So none of them are required at all. Okay, there's a lot of ads for it. There's a lot of this one, which especially the douches for vaginal cleanliness, absolutely not necessary. So one of the beauty of the basically the female reproductive organs is that it is self cleaning. It does everything that it needs to do on its own. You don't have to do all that much. And vaginal douching, we don't recommend because there is a pH that needs to be maintained in the vagina to make sure the infection rates stay down. Now, when you end up douching, that whole balance is off because there is good bacteria also that are present in the vagina. So when you do a douching, even that goes. So basically, you're breaking down the barrier which is keeping you away from the bad infections. So you become a high risk person for getting infections. Now, all these are marketed for reducing infections, making the odor better, and whatnot, but they actually do the opposite. So unless absolutely required for you medically, there is no reason for anyone to do this regularly at all. And beautification, I think there are bleaching agents and all of that available right now. Women have to remember that having a bit of discoloration in the vulva around the vagina is very, very normal, very common because one, it's a damp area. Second, it's between the thighs, which cause a lot of friction. So bleaching agents near the vagina, not a good idea because it causes a lot of irritation. You end up with rashes and it's not really going to lighten anything. Once you might use it once, you might see a difference. It's going to be back to square one because of the position of everything down there, basically. So please don't use any of these. You're only going to make your own life harder. That's it. So your body takes care of itself. You don't really need to do all that much to make sure. The only cleaning that would be is the outer part. So the labia needs to be just cleaned every time you use the restroom. Even that doesn't require strong soaps. Just water and making sure the area is dry is more than sufficient.
Yeah. Also, it's not supposed to.
Exactly. And odors the vaginal odors are also dependent on the time of your cycle, on the food that you eat. So there's only so much you can do. It's basically akin to putting perfume on body odor. Doesn't really change all that much.
Yeah.
So changing diet, making sure you're generally healthy will make sure things are healthy down in your female reproductive areas also. Otherwise, doesn't really make all that much of a difference.
Definitely, and thank you so much. Thank you so much. Now, before we coming to the end of this session, I would like to give the last question here. And this question comes up again and again. This is the right person you need to ask. How old are you? 80.
Yeah, I couldn't hear your question.
At my age,
I don't get it.
Is it okay to wear
menstrual cups you're asking about? Yes. So there's no age limit for menstrual cup. As long as you're comfortable, go right ahead, because this is one of those few menstrual products which are reusable. Make sure it's cleaned every time you use it, or every day. There are instructions per type of cup also. Clean it with hot water so that the disinfection happens. Make sure you remove the cup every 6 to 8 hours. Don't keep it on for too long also. And there's no issue. Go right ahead with using the menstrual cup. Just make sure you use the right size for you so that you're not uncomfortable through the day. So that keeps changing with each life milestone that you reach, and depending on the muscle laxity also. So it shouldn't be too big. If it's too big, it's going to be uncomfortable. If it's too small, it's going to be uncomfortable. So it takes a bit of trial and error to find the right size for you. But once you do, go right ahead.
Thank you.
I'm a huge fan of
That's nice. Because a lot of menstrual hygiene products are plastic based, basically. So moving to a menstrual cup reduces the environmental burden also of things.
Definitely. And with that, we come to the close of the live session. I genuinely mean it. Thank you so much, and kind, and brilliant for everything.
Thank you. It was great being a part of this whole session. I hope
Thank
it
you.
was informative for everybody who required it.
Absolutely. I now know for sure my vagina is like a cat. I just need to be let it be. It will take care of itself.
Yes. That's the take home message today.
That's the takeaway message. Let it be.
Yes.
Make sure you go to your gynae, get pap smear, get your vaccine. Just make sure you're taking care of yourself, and that is the message we want to drive home with Divya Wellness as well. Every woman deserves to take some time out. We're working hard to take care. Anybody's sick in the house, we are taking care of them. Please do take a moment to understand what your body is feeling, spend time with it, and do see your doctors, whenever it's very, very important. Thank you so much, everybody who has stuck around. You have been patient with us. Instagram, Facebook. Thank you, everyone. I hope you have a good day, and see you next week. Bye. Thank you.
Thank you.